Hi, my name's Anne. I'm one of the nurses on the MSK helpline, and I was wanting to talk to you today about sleep. Because at the moment, many people are feeling more anxious. With musculoskeletal conditions, people have ongoing persistent pain, and that can all make it difficult to get a good night's sleep. It's getting good night's sleep, but it's staying asleep, and it's also getting good quality of sleep as well. So I thought I'd talk about it, just a few tips of things that might make it easier for you to get a good night's sleep. Firstly, don't stress about getting a good night's sleep, because many of us worry, are we going to get a good night's sleep? And that can actually, cause increased anxiety and cause us to stay awake. Also too, making sure we try and get a good routine for sleep, trying to go to bed at a similar time each night, trying to do all those things like having a hot shower before bed, not looking at screens and computers and phones before bed, not having caffeine for several hours, as well as alcohol before bed. So you're trying to get into a really good night's sleep and a good routine. Making sure that you're in comfortable clothing, that your room is warm, not too hot, not too cold. Also that it's dark, as lots of people don't like to have light, as that can keep them awake. Trying to have reduced noise. Now sometimes you can't always have control over all that, so you might have earplugs, or you might have some really gentle background noise that's in the background. Also learning things like practicing some relaxation techniques. People like to do all sorts of meditation and relaxation and just simple exercises that will help them relax and then get a good night's sleep. And that all just makes people feel calmer, less pain and less anxious as well. Also, you might keep a sleep diary. So if you are having difficulties, you could talk to your doctor about that, and it's got a bit more information about, what time you go to bed, what time you get up, or maybe how many times you wake up a night and things you might have tried. It's often a good idea too to get up at night. Like if you can't sleep, get up, have a bit of a walk, maybe get a warm drink, nothing with caffeine. It might be a warm milk. Also maybe do some simple stretching exercises and try and relax a bit before you go back to bed. Other things people might do, if there's something that's they're thinking about, they might get up and write it down. So then it's written down, they know they're not going to forget it, and they can get onto that the next day. So it's just lots of things about trying to really get into a good routine, so that we are more relaxed and then are able to sleep. Because certainly when people really don't have a good night's sleep, it can make their pain worse, but also like more increased muscle tension, and also they can really get more anxious, and that can go round and round a bit. So also to look, if you are having quite a bit of pain, to talk to your doctor about that. So you're trying to do all those things to try and get into that really good habit of getting a good night's sleep. You can also phone one of us. You can talk to the nurses on the MSK helpline. We're available every day, Monday to Friday, 9 to 5, and you can phone us on 1800-263-265, or simply email at msk.org.au. We are getting a lot of calls at the moment, so sometimes email is a really easy way, and then we can get back to you. Okay, thank you very much. Bye.